If your baby is having a hard time entering into the pelvis, one of the magic moves that you can do is Walchers, which can help to create more space in the front half of the inlet to allow baby to slide in. So in this video, we're going to break down what is Walchers, how does it work, and then go over some alternatives that you can do in case Walchers is not accessible to you. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife.
Before we dive into today's video, be sure to check out our newly released book, Training for Two. It's all about how you can use prenatal fitness to help prepare to open your pelvis for birth with tons of videos, images, and then also some education on how to create more space in your pelvis with different types of movement patterns. So check it out on Amazon right now. The book comes out in September. So before we get into what is Walchers, let's discuss how we open the top of the pelvis. It's important to note that the pelvic inlet or the top of the pelvis opens differently than the other pelvic levels. So there's no one movement that opens the entire pelvis. The pelvic inlet also has a front half and a back half, or an anterior and posterior portion, that both open in a slightly different way as well. And so when we're trying to create space in the top of the pelvis, we're doing kind of an alternating movement back and forth to create space in the front and then in the back, and just kind of alternating between the two to help baby kind of wiggle and rock into the pelvis. With Walchers, we were specifically focusing on the anterior inlet, or the front half of the pelvic inlet. The pelvic inlet is going to open more with external rotation of femurs, or knees moving outwards with the knees out, ankles in. This is going to create space more side to side. In addition, an anterior pelvic tilt or arching in your back makes it easier for you to find external rotation, because your pelvic position really influences how that hip position can influence pelvic diameters. In addition, when we have a more anterior pelvic tilt, it changes the pubic bone angle and can make it easier for a baby to enter into your pelvis. So this is a key reason why Walchers is really effective with helping baby get into the pelvis if they're having a hard time engaging. The way that we get into Walchers is you're going to come to the edge of your bed. And now you can do this with an epidural with some assistance, but typically this is going to be more common with somebody who is unmedicated or does not have an epidural. So you're going to be at the very edge of the bed, and usually putting like a pillow or rolled up yoga mat right at the sacrum area can be really beneficial. And then your legs are just going to hang off the edge of the bed. And so sometimes you feel like a really big arch in the low back, which can be really uncomfortable. If that's the case, you're probably going to get really big anterior pelvic tilt, which can be making it easier for you to find more external rotation, which can create more space side to side. And like we discussed before, with that anterior pelvic tilt, it's changing that pubic bone angle in the front. It can sometimes make it easier for baby to enter. And so you would maintain this position for about 3 to 5 contractions, or until you felt a big shift. So if you felt a big shift after one contraction, you can go ahead and get out of the position. It's important to note that this is a really uncomfortable position to maintain. There's a lot of stretching here in the hip flexors. It can be really uncomfortable in the low back. So this would not be my first resort if somebody's baby was having a hard time entering or engaging into the pelvis. So an alternative to Walchers can be the mermaid pose, where you're going to take a peanut ball, which most hospitals will have one available for them. This is usually not an investment that I would say is necessary to make for you to labor at home or for your own prenatal use, because I really only ever see these used during labor. So you're going to start by placing the peanut ball between your knees, so that your knees are wide and your ankles come together. And so this is going to be prompting that external rotation, which can help to create more space side to side in the top of the pelvis. And the next thing that you're going to do is you're going to push your hips all the way forward. And now when you're pushing the hips all the way forward, you may be tucking the butt underneath, or full hip extension may be helping you find more of a posterior position, which actually could be moving the back half of the pelvis backwards, so that sacral promontory, to create more space front to back. However, it's easier to find more external rotation and create more space side to side with a little bit more of an arch in your back. So you can figure out what feels most comfortable for you in this position. You would maintain this for about 20 to 30 minutes, and then you would flip over to the other side for 20 to 30 minutes, or until you felt a big shift. And what's good about this position is, one, it's really restful, it's usually comfortable to be in, and it's really accessible if you have an epidural. If baby is still not entering to the pelvis, we may need to help them with their rotation so they better align to the pelvic inlet. And the way that we can do that is by opening the upper mid-pelvis with a one-sided open hip position, which creates more space unilaterally in this half of the pelvis. And so babies are usually trying to rotate on the left side. So you can put your left leg up onto a peanut ball in this fire hydrant position like this. Or you can come into an exaggerated side lying position like this, where the top leg is in an open hip position and the bottom leg is kicked out behind you. This one may be more accessible for you if you have an epidural or you're really wanting to rest, but both positions are creating more space in the upper mid-pelvis to help baby rotate and then enter into the pelvis. So if Walchers or mermaid pose don't work, you can try one of these two movements to see if we can adjust baby's position and then come back to mermaid or Walchers and see if that finally helps baby engage. If you're trying to help your baby enter into your pelvis and they're just having a hard time doing it, we can do the magic move of Walchers, which helps to create more space in the anterior inlet to help baby get behind the pubic bone so that when you come back up, they then slide into the pelvis. If Walchers is uncomfortable, we can also do mermaid pose with a peanut ball, which is also really accessible if we have an epidural, or we can create more space in the upper mid-pelvis with one-sided external rotation in an open hip position to help baby rotate to enter into the pelvis, and then try mermaid or Walchers to help baby engage. If you like this video, be sure to like and subscribe to our channel so you get notified whenever we release new videos. We release 1 to 2 educational videos a week and 1 to 2 workout videos a week as well to support you during your pregnancy and in your postpartum. And then be sure to check out our newly released book, Training for Two, that you can grab on Amazon now for pre-order.